My aha moment with precision flow and Hi-VNI technology came really early on. As a matter of fact, it was my first patient. I walked into the emergency department ready for a night shift, and there was a team of folks, including our respiratory director, that was there to introduce me to the technology. They said, "Hey, would you give this thing a go? Would you kick the tires on us and tell us what you think?" To me, it looked like a really simple piece of equipment. They gave me 10 minutes of training on it. There was one button, something so simple even an ER doc could do it. And within minutes, a patient came in respiratory distress by ambulance, who I knew and had taken care of in the past. This gentleman was tripoding, had history of COPD, came in on pressure-driven CPAP from EMS, and really needed some sort of advanced modality to care for his disease. He had been on non-invasive positive pressure in the past, and I asked him, "Hey, would you give this a go?" He said, "Sure." Or kind of nodded with his respiratory distress. So we hooked him up, and within 10 or 15 minutes or so, I knew that this was really something. This guy turned around really quickly, and they convinced me that indeed he could be admitted to the medical floor rather than going on positive pressure and ending up in the ICU. And so that made my life a lot easier. Now, about 30 minutes or an hour later, my partner had a similar patient come in. We treated that patient on precision flow as well. That patient did well and was admitted to the floor similarly. And so that right there sold me on the technology. My comfort level has greatly increased. At first, I didn't know what kind of patients I could treat with it. How effective was this going to be? And what I've found is that it has virtually replaced non-invasive positive pressure in my practice. Do I still use BiPAP, CPAP? Of course I do, but it's a really small sub-segment of my population. A lot of times, these are folks that I'm receiving sign-out from, and I haven't even initiated that therapy myself. Has it replaced BiPAP in my practice? I would say almost 90%. Why? It's easy, it's efficient, the patients like it, and it gives me the same or better results as they were getting when I was using a mask.